Hello, I'm Dr. Adriana Potter. On the Benefit Yourself series today, we're gonna actually go over a nice little feature that is being out on the market, and it's called PeriFit, which is a sensor that can help you to do Kegel exercises by using the app. Before we go over how the PeriFit can help you to exercise your pelvic floor muscles, let's go over about the connection between your pelvic floor muscles and your bladder and understanding your pelvic floor muscles and their function. Did you know that about over 50% of the women have some sort of bladder issues? And about 13% of men have bladder issues. And about 60% or more of the people with back pain have bladder issues as well. Well, you might go to your doctor and say, hey doc, I'm having issues with my bladder. And they will tell you, well, what do you expect? You have babies, you're getting old, it's normal. Guess what? It's not normal, okay? So let's just stop saying it's normal because you have babies or you're getting old, because it's common. Common and normal are two separate things. Right? It's common for women that have pregnancies to have urinary issues, but most of the time it resolves within 3 months postpartum. And if it doesn't, you need pelvic floor therapy. Okay? As you get older, your pelvic floor muscles will change. The change of hormones will affect your bladder and your pelvic floor muscles. So it's common to get some bladder issues, but it's not normal. But before we go over about getting the control of the bladder, let's understand the relationship between your pelvic floor and your bladder. Well, I have here my Susie, right? I call Susie my pelvic floor model. And here it is your pelvic girdle, all right? The muscles on the bottom, they form your genitals. And for men and women have the pelvic floor. They just have different shapes. But the anatomy in general, the muscles, they're all the same. They contract and they relax, right? And if you look inside, it's a little bit out of position in here, but for a woman, we have the uterus right in the middle, the bladder right in the front, and all the way in the back over there is your rectum, okay? I'm gonna take some of the organs out so you understand a little bit of the relationship. Here goes the uterus and your ovaries. So if you have a hysterectomy, you don't have this anymore, but you have the bottom part, which is called the vaginal canal, okay? But if you look inside in here, you can see a little bit more clearly about the pelvic floor and the bladder and the rectum. Oops, there it is. I think you can see it better, all right? And your pelvic floor, how it's working to support these organs that I just discussed with you, okay? So the pelvic floor muscles are responsible for bowel and bladder control and sexual appreciation. Now we're back talking about the PeriFit. So let's go. So I just got my package today and I'm very excited to open up and go over with you with the whole process of setting it up. So I have no idea how good it is. So here's my package. I open up like this. I got my package, so I'm excited. So it's brand new, okay? And it comes nice and neat in this cute package over here. I'm gonna get a little closer. There you go. It's called PeriFit. And on the back, it has some of the directions for you to kind of go over what that product is involved. And then you also have some of other information that you'll be using your phone to do some of those Kegel exercises that can help your pelvic floor to get a little bit better coordination. So I am a pelvic floor physical therapist for 16 years now, and I've been using biofeedback a lot with my patients. And I believe this PeriFit seems to be something that it will provide that feedback for women that are very visual and have a little bit of that poor awareness of their pelvic floors doing it. So let's see how it goes, and I will be the subject, so and giving the clinician perspective of what this is going on. Okay, let me open the package. So brand new in package, so I'm just opening up for the first time. So let's see what's inside. So we're gonna slide it out. So I have a lot of nice little slip cover in there, and I think, let's see, does it slide this way? Yes. Oh, and lift this way. Alrighty. Ooh, okay. So this is how it looks inside. Okay. and this is the sensor. I saw the infomercial about it on Facebook, and I contacted the company and I say, hey, would be willing to send me a product so I can do a clinician review about what this is. So it seems to be based on the silicone. I'm going to read the directions and kind of give you more information. And yes, this is going to go inside the vagina. So the product has a little sensor in here that it will kind of connect with the app and then show it. So let's see how it is. And there's a power button in here, and I believe that it's gonna have to turn it on. So inside the package also has the directions, which I haven't read yet, and also the QR code for the users to download it and kind of go over that. So I'm gonna actually see what happens. I'm gonna get my phone and kind of get started with the user guide. Let's see how user-friendly that is gonna be, okay? I downloaded the app and it was very straightforward to launch it and follow the prompts to install it and set up your profile. And at one point, it will ask you to insert the PeriFit to do some calibration. My little caveat about the PeriFit is if you're already having pain with inserting a tampon, this is probably not going to work for you because the PeriFit is a little bit wide, as you can see on the top of my hand. Is about 1.5 to 2 fingers width. If you having pain with the tampon, which is about 1 to 1.5 finger, the PeriFit, it will probably cause pain, and that is one of the contraindications of using it. You can always try and see how your body kind of calms down by doing it, but I wouldn't do that before talking to your physical therapist. So just make sure that if it is a little difficult to put it in, use the lubricant that they recommend, the water-based lubricants, to insert the PeriFit in, okay? So let's get back and how to use the PeriFit. All right, so I washed my PeriFit and I went to put inside, and suddenly I realized that my bladder was a little bit full. So I would recommend it that you don't have a full bladder before you put it in, because it kind of will feel a little weird. So I emptied my bladder first, and then I was able to insert. It does say to use a water-based slippery stuff, and I would say that's optional. And use it only if you're really, really dry in the pelvic area, because sometimes when we're using sensors for biofeedback, or using dilators, will be okay to use the slippery stuff. But if you're using like a sensor and you're trying to do exercises, you will expel that inserted like a sensor, or like in this case the PeriFit sensor, more easily out of the pelvic vault, the vaginal vault, okay? So for me, I did not have to use any slippery stuff, and I just slid my underwear on it, put my pants on, and I walked back here to continue filming the video. So it was not uncomfortable at all, despite of looking quite wide. So I was surprised to put it inside and find out that it was nice, comfortable. It was easy to insert it, and it doesn't feel uncomfortable to stand and walk, okay? So the recommendation for this exercise should be laying down. But then we'll kind of talk about it, why you should be doing things in different positions, and hopefully the app will bring me to doing that in different positions, okay? All right, so let's go over to set it up to do in the laying down position. And let's see. So ask me to press on the next button to position. So I'm ready, I'm well positioned, okay? Insert, I already did it, so I'm ready. It has a nice little, sketch for you to do, to kind of see how's that, where it's supposed to go. I'm pretty sure you know where your vagina is. So alrighty, next one. Great, now let's calibrate. So your pelvic strength naturally varies from day to day, even though throughout the day, fatigue and everything. So we calibrated PeriFit before each session to adjust the gains and measure the optimal challenging for you. Okay, let's calibrate. So this is what I'm going to show you. This is kind of very, very neat. I like this a lot. So I am going to just do a Kegel here. You're going to see the green dot is going up. Alrighty, you see the green dot there? Oh, good, good. So I'm going to go ahead, squeeze the pelvic floor muscles. Now I'm doing abdominal one. Excellent. All right, now I'm going to just this abdominal muscles. Oh, and it's funny because it's not the red. Oh, there you go. The red is coming along. So I'm just doing a little bit of that bracing and let it go. As you can see, the bracing, it kind of wants to work It activates my Kegel, and then the bracing keeps increasing the tension. So that's a very neat feature in here for the pelvic floor and abdominal transverse muscles. I'm gonna relax in here. Whew. Breathe it out. They should be nice and relaxed below those dotted lines in there. Good. Now I'm gonna squeeze it all the way. Just Kegel. Now abdominals and let it go. Beautiful. I really like this so far. Alrighty. So nice, because now they're both relaxed and they're both on the same, on the bottom area here. And that's what you want to see when you are at rest. Okay? So when you relax, they should be all the way down there. So far, it's working like a beautiful feedback. That being said, it kind of changes position. So remember I told you, you want to make sure that you're doing your training in different positions. The nice thing is that when you're telling you to sit, the picture that they showed this person sitting, they're not fully sitting on the bottoms. They're sitting more towards the back of the butt. So there's no pressure over the perifit. And it will track progress. So right now I don't have any data because I just did for 1 day, but it kind of goes in there. And it's similar to what a biofeedback machine would do it. But like I said, this is a much, much easier and straightforward, user-friendly machine for you to do it. And so I'm extremely pleased as a clinician to do it, to use this PeriFit for myself. Okay. Alrighty. So I'm gonna, like I said, want to sit down here. Alright. So I'm kind of not putting pressure in here, so it's still inside my pelvic area. And I think you can definitely do some exercise in this position. So you're not fully sitting on your bottom, so it still will be kind of comfortable for you to do it. You can also do on the sideline, right? So it doesn't have to be doing on your back, so you can be doing on the sideline. You can still use the app in there. And of course, you want to eventually be doing that in standing, okay? So I will be probably right now, this is, I think, is very neat. Just for the first time I'm using it. Like I said, I just opened today, follow the instructions, super user-friendly, easy to put it on, easy to install the app, and kind of play and calibrate and follow the directions. So it kind of walks you through the whole step and don't really have to worry about, feeling like if you think you're not computer savvy or anything like that, don't worry, you'll be fine, okay? So this is, I think that I will try to use it for a month. And then I might do another review later on, how is that, and kind of share a little bit more what was my experience over a period of a whole month, so I know exactly what did change, how my pelvic floor muscles change, if I felt like, did the coordination get better. The only thing that I was hoping that perhaps to see, because some women have issues with urine control when the periods come. And as I'm aging, unfortunately, I'm finding that to be true for myself as well. And unfortunately, I did experience my leakage once or twice when I have a very full bladder. And I was very long interval. And it was about my period a week before. And I rushed the bathroom, knowing better that I'm not supposed to be doing that. And of course, I did have some leakage in there. And that's one time it happened. And I was upset at myself because I know better how to control. And the other time that I had it, it was actually similar situation, full bladder, very long interval. I was gonna attempt to go to the bathroom and then I sneezed. And so I just I overstretched my limits, okay? So it's important to understand that you need to know in terms of how much symptoms will improve, has to know like being aware of what is currently happening to your pelvic floor and what your current symptoms are. So if you're not fully aware when you're having issues and you're not paying attention, and going to a pelvic floor physical therapist usually helps you to become aware when you have issues and how to address that. Because doing Kegels alone, that's not the solution. It is part of the solution. It is part of the rehabilitation of your pelvic floor muscles, but it's not the only thing that will help you to get bladder control. So you want to be strong, you want to have coordination, you want to have endurance, you want to be able to recruit your fast fibers, but you need to understand the behavior behind that. So we over time engage in bad behaviors about our bladder. We feed into mixed message to our bladders, and that's important to understand what's happening to those behaviors behind the bladder issues. And going to a pelvic floor physical therapist will help you to understand them. And the PeriFit will help you to make Kegels more interesting and easy to strengthen your muscles. And it will have improving the strength, the muscle tone, the coordination, the endurance, the recruitment of your fast fibers, the recruitment of your slow fibers. And of course that, every time you have better muscles down there, you're gonna have a better sexual life as well. You're gonna have a better sensation down there because you have more awareness. Okay, so I think the PeriFit is an amazing product, and you will find the link for this product down on the description for you to get it if you find that it is something that you would like to add it to your current rehab program for your pelvic area. And I personally, as a clinician and as a user, I think it's an amazing thing, and hopefully you find that too. Okay, I'm Dr. Adriana Potter on the Benefit Yourself series. Today we went over the PeriFit, and hopefully you enjoyed the video. And you have any comments, you have any questions, don't hesitate to put down on the bottom. Don't forget to subscribe and press the bell button to get more information on our future videos. Have a great day. Bye bye.